evening. My name is Adaeze May. Welcome once more to Empowerment Series. And today I'll be talking about diabetes part 2. Last week we talked about what diabetes is, and we talked about how diabetes can be acquired. We did talk about the symptoms of diabetes. Today I'll be talking about the types of diabetes and how you can manage diabetes. Now, we have several types of diabetes, but I want to talk about 4 types today. So we have the type 1 diabetes, we have the type 2 diabetes, we have the pre-diabetes, and then we have the gestational diabetes. With type 1 diabetes is an autoimmune condition in which your own system attacks and destroys insulin producing cells in your body. Now, the type 1 diabetes, I did say, is a juvenile diabetes that usually affects the children or the young. Sometimes adults can also have this. Now, with the type 2 diabetes, this is a condition, this is a very chronic one, and usually can affect any kind of persons. It can affect a child, it can affect an adult. Now, with this one, your body is not able to use up the insulin, or can't use up the insulin properly, or the pancreas is not able to produce enough insulin, or it's not producing at all. Now, I did say that with this one, yes, it affects an adult, it can affect, but the problem is that when not treated, it can lead to other diseases like a kidney disease, it can lead to a heart disease and other conditions when not treated properly. Now, the pre-diabetes is actually a condition where fasting blood sugar level is high, but it's not significantly high enough to be placed as diabetic. So it's not significantly high enough to be placed as diabetes. So it is not high, it is not low. So for the pre-diabetes, it is not significant enough to be called diabetes. So with the gestational diabetes, is actually a diabetes that is diagnosed for the first time during pregnancy. So in this condition, insulin blocking hormones are produced during pregnancy. But it is said that with this one, after the pregnancy, it goes away. Gestational diabetes, it goes away after pregnancy. But one thing you have to know is that with the gestational diabetes, you also are at risk of type 2 diabetes. So it is something that you want to check probably after pregnancy. Now, the next thing I'm going to talk about is how to manage diabetes. So I'm talking about the management of diabetes. How can diabetes be managed? So if you have diabetes, there's no cause to worry, because you can be managed by your healthcare professional. One, you will have to go to the hospital, like I said, visit the laboratory, know your fasting blood sugar level. The last time I did talk about knowing your fasting blood sugar level. You want to get a glucometer. A glucometer is a machine that is used to check your sugar level. So you get a glucometer and you'll be monitoring your sugar level. 2, you'll be put on medication by your healthcare professional. Please don't take a self-medication. You have to go to the hospital and let the doctor give you medication to manage your diabetes. The third thing you want to do is you want to have a healthy lifestyle. You have to watch the things you have to do. So you visit your dietitian. Your dietitian will advise you on the food to eat and the food not to eat. And please, when they do that, you stay with it so that you can live healthy life. Another thing that you want to do to manage your diabetes is you want to have a regular exercise. And please don't have a strenuous exercise that will rather give you more complications. So you want to be careful of the exercise, but you have to have a regular exercise, have an activity, live a healthy life, drink a lot of water, and take a lot of vegetables. Okay, again, not all vegetables are good for a diabetic person, so you want to see your dietitian and follow what your dietitian is saying. Now, another thing you want to do when you have diabetes is that you want to rule out any underlying illness. You want to check your kidney, you want to check your liver, you want to check and make sure that you don't have any underlying condition. I believe that today you've learned a lot. All that I said is not exhaustive, but it's for you to have a general idea of what to do when you have diabetes. Once again, it's Adaeze May. See you again for another series. God bless you.